Hello, welcome to our Co-ops in the Time of Crisis Conversation series. My name is Jen Budney, and I am a professional research associate at the Canadian Centre for the Study of Co-operatives at the University of Saskatchewan. And today I am delighted to have with us Ushnish Sengupta from the University of Toronto OISE, right?
Yes.
And Ushnish is finishing his PhD at OISE. He has a long history of working in the social enterprise sector in Toronto, and he also writes about cooperatives. And so I have used, Ushnish, I wanted to say, I value your writing so much on co-ops, and there is one of the essays that you've written on the complicated relationships between cooperative history and colonization in Canada is really, really important. And so whenever I teach the co-ops or the social economy class, I use that paper, and I think it's one of the papers that our students value the most. So I'm really thrilled that you could join us here today. I also have with us to help conduct the interview Brady Kroeker, who is moving into a second year of the Masters of Public Administration program at Johnson-Shoyama Graduate School of Public Policy, where the Center for the Study of Co-operatives is housed. Brady also has already a master's in political science. And he has a long history of working in the disability sector, which is one of the main subjects of our conversation today. So Brady, thanks for coming to help me out with this interview. And I'm wondering if you could give a little bit more background for Ushnish and for our viewers.
Absolutely. Thank you for the introduction. So as you say, I do have a master's degree in political science or political studies from here at the University of Saskatchewan. And I wrote on disability and employment policy within the Saskatchewan context. So it's more from the legal perspective and how that interplays in how public policy is formulated. I do work nationally in the disability sector, kind of on what is known as the consumer side versus the service provision side. And I do that through a national organization for disabled students, and we've been around since about 1986 or so. And our main focus has been mainly on students, but also interacting with mainly the federal level at this point in time to create policies and to influence policy for this cohort, for this portion of the disability sector.
And so, thanks, Brady. Ushnish, you have a long history of working in social enterprises that employ people with disabilities, and I know that this is also the subject of your PhD research. I'm wondering if you could tell us a little bit about your own background in this area before we begin the interview.
Yes. So before starting my PhD, I worked extensively in the nonprofit sector in the Greater Toronto area. And so one of the nonprofits that I worked for, and in fact, I founded, was a social enterprise called Free Geek Toronto. And it refurbished old computers and got them out to people who didn't have or couldn't afford new computers. And in that process, we employed a number of individuals who were essentially social assistance recipients in Ontario. They're either Ontario Works recipients or Ontario Disability Support Program recipients. And as part of my academic work, I had the benefit of doing a couple of case studies on organizations that specifically serve people with intellectual disabilities and developmental disabilities. So I took that on as the main subject of my thesis.
This conversation series, as you know, is looking at how the COVID-19 pandemic has affected cooperatives and social enterprises. And I'm wondering if you can tell us a bit about that kind of in a nutshell. I know there's lots of detailed information that you're going to provide to us.
Yeah, so in terms of the, and just to kind of, my interest in cooperatives and social enterprise in general. So I'm really interested in how marginalized communities are involved in the social economy. Most of the time, they're involved as clients of cooperatives, of social enterprises, but I'm really interested in how racialized communities or people with disabilities start up and maintain organizations of their own in the social economy. And just anecdotally, I've been hearing that the social enterprises, for example, that generate revenue by selling goods and services, they are not able to carry out business as usual. So they are facing a big shortfall in terms of their revenues. And I'm anticipating, again, anecdotally from the surveys done, let's say, for example, by Imagine Canada across the whole charitable sector in Canada, that people are anticipating a drop in government funding from across, federal and provincial and governments. So these organizations which are dependent on either revenue generating activities or government funding are facing shortfalls in both. And my concern is a lot of them will not survive. We've already seen a lot of businesses, like for-profit businesses, close down for good. They're not coming back. In Toronto, the estimate is anywhere between 25 to 30%, especially retail businesses. So I'm concerned that we could see the same effect in the social economy with social enterprises, with cooperatives, that some of them will close for good.
One thing I was curious about, Ushnish, then is, as you may know, there's quite a bit of money being pumped into the system at the federal level for organizations in the disability sector. I'm curious, have you seen a lot of the projects that people are starting to build, or have you kind of seen like maybe people being a bit hopeful with all this extra money being placed into the system? For example, there's about $1 million in targeted funding specifically for the disability sector at this point.
Yeah, so I mean, the policy initiatives, I just see them as a real kind of mix. So on one hand, there's some funding, even for, as you mentioned, maybe organizations with disabilities, there's additional funding I've seen at the provincial level for Black community-led organizations and so on. So my feeling is that the level of funding is a drop in the bucket. It's a temporary kind of band-aid that may help some organizations kind of survive, but I would still be worried about the long term. And in terms of the individual disabilities, there has been all kinds of guidelines given to, say, the healthcare sector, saying, if it comes to that point where we don't have enough ventilators and beds, it specifically listed, and it was individuals with autism as being people who maybe are not valued as much as other people, and therefore they may not get those resources. And we're seeing those, by the way, it's not like a Ontario phenomenon or Canada phenomenon. We're seeing that those same guidelines in place today in the southern states, which are facing those shortages. And we're seeing, so it's, on one hand, it's nice to hear that there's a couple of announcements on the funding, but how does our culture treat people with disabilities when push comes to shove and the resources become really scarce, right? Mm-hmm. That's my question.
For sure.
So that's fascinating and really, really hard. So my first question is, you're saying that these policies are actually, at this point, written policies?
Oh, so in the case of Ontario, it was a written policy that was distributed to the healthcare sector. It wasn't like a public document on a website or anything like that. And then the disability advocacy organizations immediately kind of got wind of it and advocated and lobbied against it. And it was a draft guideline, right? But, even to put things like that in a draft guideline, it becomes the guideline in the absence of any other guideline. So, and thankfully, in at least in Ontario and as far as I know, in the rest of Canada, we have not reached that point where the healthcare system is making those rationing decisions regarding people who are senior citizens or people with disabilities and so on and so on. But it's, yeah, and I don't think there's other things going on that maybe the government is not addressing that will have a long-term impact on the social economy in terms of individuals with disabilities. So for example, in Ontario, we've gone completely online with the education, especially K-12 education. And there was no consideration in the education system, the students with disabilities, students with special needs. So there's no consideration for students with special needs because they didn't necessarily have all the equipment at home that they would have had access to at school, in educational institution. They didn't have the support workers that they would have in an educational institution, or perhaps sometimes in a nonprofit organization where they might spend a part of their day and so on. So I think none of those considerations were put in place, and as far as I know, still haven't been addressed, and which means students with special needs will fall further behind. They're already behind. They're never treated equally in the first place, but they're further behind. And the social economy, the cooperatives and the social enterprise and so on that employ, that end up being the employer of choice or the employer of last resort, maybe in some cases, for a lot of students who graduate from, let's say, high school with a special need or so on, and can't find a job in any other place. They're just going to be further behind in the skills they have in terms of so I think there's long-term issues in terms of how the government is dealing with the pandemic that will, I think, going back to your original question, dwarf the short-term, the long-term costs will dwarf the short-term funding that's being provided. Yeah.
Did you have something to ask, Brady?
I do, actually. When we were talking about what's happening in schools, as you would know, Ontario is one of the few provinces with accessibility legislation in place. I'm curious how that legislation is maybe helping and or hindering the disability community at this point. I know it's been in place for a few decades at this point, or a couple of decades now. I'm just curious if you could explain maybe how that process is working now.
Yeah. So, and as you mentioned, Ontario has the access to AODA. In short, I always forget what the acronym spells out to. But if you kind of see some of the publications by, like, the AODA Alliance, which is one of the organizations that monitors the implementation of this act, they will say that yes, the act exists, and yes, there has been some benefits for the community, you know, over the past few years since the act was put in place. But the act doesn't have any teeth. It doesn't have any compliance procedures. So what? And a lot of businesses are kind of throwing their hands up and so what? And not complying with the act. And there's no substantial penalties or other mechanisms to make. When I say businesses, I'm also talking nonprofits and social enterprises and cooperatives to comply with the act. So that's a big problem. And the other piece I'd say, kind of linking it to education as well, and the social economy as well. So each school board has in Ontario is legislated to have this special education advisory committee, which consists of members of the committee, which ends up being mostly organizations serving individuals with disabilities. But again, if you read some of the publications by the advocacy organizations, you see that the social economy organizations, which have a seat at the table at these special education advisory committees, have had no big impact on the way the school boards treat people students with special needs, or they would like to have a greater impact, but they're not having the type of impact they're having. So I think in terms of, I mean, you're like a policy student, so in terms of the policy, it's there, the words are there, but the implementation isn't.
Implementation, yeah. Well, I find that that's what happens with a lot of legislation that's being built now, especially at the federal level, where the act is there, but now you have to set up committees that are going to build the standards that build the teeth in that you're talking about. And just for our audience who maybe aren't as deep in the weeds of this as me and Ushnish are, there are kind of two sides to the disability spectrum. There is the service provider organizations is the term I use, which Ushnish has been talking about. And then there is the consumer organizations, or the organizations built by persons with disabilities for persons with disabilities. And that's another completely different wrinkle, we could get into later possibly, but that's just a clarification for some folks that aren't as engrossed in this as we are every day.
I'll also just jump in just to say AODA stands for Accessibility for Ontarians with Disabilities Act.
Thank you.
So I Googled that as you were talking, Ushnish.
Fantastic.
So everything you're saying points to the fact that inequities that existed before the pandemic have been exacerbated and are at risk of being even further exacerbated by both the kind of natural response to the pandemic, the closing of things, but also the policy response to the pandemic. And just to get back to something that you were saying earlier about the funding being provided being a drop in the bucket, at least for social enterprises, obviously the whole point is that they're going to be self-generating a good portion of their own revenue, and that's usually through the provision of different kinds of services. So I know here, for example, the organization Build Up that Quint Development runs employs ex-gang members from the organization straight up to work on construction projects in the city. Well, that had to be just shut down when COVID first hit. So I think they can start to open up a little bit now, but there's still a lot of nervousness amongst homeowners who might want to employ them, having people in their space. So sorry, you can see my son in the background. This is one of the hazards of working from home.
Yeah, what's the Zoom video without a kid in the background?
Oh, right, or a cat walking across the screen.
Or, some screaming in the background. I like it.
So the even the kind of measures of the level of self-sustainability that they have has been hugely curtailed, if not cut off completely. This is affecting people with disabilities. Ushnish, when we talked about doing this interview a couple of weeks ago, you talked about the important intersection of this with Black Lives Matters, and we are seeing that play out in the news, obviously, but it also is playing out on the ground in terms of how people are being affected by the pandemic and the policy responses. Do you want to say a little bit about that?
Yeah, so I mean, and going back to the point you just made, so the pandemic is actually exacerbating all the existing inequities in society. So for example, in terms of the jobs, and it's being called instead of a recession, a she-session, because the majority of individuals who lost their jobs were women, and some of the data from the stats can shows the majority of people being hired back, as you see the employment numbers come back, are men. It's not that it's the woman who lost the jobs first that are being hired back. So the same applies for racialized individuals. We don't have a lot of data on race in Canada in terms of employment numbers and so on. But you can see from the States and from the COVID numbers as well, the communities being hardest hit are the racialized communities in the States, the Black community, and there's some evidence in Toronto and Montreal that some of the clusters were based on individuals who worked at, say, hotspots like long-term care homes, and most of these individuals were racialized individuals. So then they perhaps were exposed to the COVID-19 and they brought it back to their communities, and it's concentrated because these would be low-income communities and so on and so on. So you can see all those existing inequities gender, race, class, disability, this COVID-19 crisis exacerbating those inequities. Another aspect I see is like the government's just trying to announce projects, like mega projects in terms of infrastructure projects that will employ people. But I think all the hard-won fights in terms of community benefits that a lot of social economy organizations, social enterprises, cooperatives, minority and women-owned businesses had kind of gained in terms of saying, hey, every big infrastructure project has to have a community benefits agreement, which gives business to social enterprises, nonprofits, women and minority-owned businesses. I think all those rules are out the window. It's all about how do we just get the money out and employ people. And my, again, concern is that this re-employment process will, again, benefit that whole hierarchy of privilege as usual, and leave behind the people who were the first to lose their jobs, and they will be the last people to gain employment back. In my view, a lot of the social enterprise and co-ops that I know about, they're employing people, not only disabilities, so other disadvantaged communities. They're all kind of in-person businesses. They're like retail businesses that sell food and other physical products and stuff. Like I know one, Haifa Co-op, that's like a technology co-op. So they were working remotely, separately, without any physical location anyways, and they're okay. But everybody else who kind of depends on that physical coming together to produce products or services, and in the process, there's those, especially in the social enterprises that I've known where you're employing individuals with any kind of disadvantage. There's the social, there's the kind of social interaction that's a positive kind of piece, the in-person social interaction. B, there's the social supports if it's part of a nonprofit that serves, let's say individuals with disabilities, all those, the social workers and other experts from that nonprofit are available and are constantly, providing other kinds of programming, like non-employment, directly employment-related programming, and so on. So all that stuff, for some organizations, is gone online. I don't know if we were to evaluate the effectiveness of the online mode of delivering these supports, how effective we'd find they would be.
Well, if you can make any comparison to the remote school situation for elementary age children like mine, it's the quality is infinitely worse. So
and that's not a comment to you as a home teacher.
No. So it's just a really hard thing to make connections over the internet.
Yeah. Mm-hmm. Yeah. Absolutely.
Yeah, I guess going back to kind of the online delivery situation, how sustainable do you think this is in the long term? Because you'd mentioned that technology co-op, and that really interested me. And as you would know, folks who are disadvantaged, including those with disabilities, they just don't have either possibly reliable internet access or an access to computers or access to all the technology that we're taking for granted and we're using right now to conduct this interview. I'd love to hear more about that side of things.
Yeah, so I mean, technology it's a double-edged sword, right? So for those who have that access, that reliable access, and the technology and the type of work that can be done remotely, this is like a boon, right? Lots of people, that I hear about, they're like working many more hours, and if they're contract workers, I guess making more income, and so on. And in terms of this kind of form of work and getting things done. But I'm really skeptical that we can provide the same level of whatever you get, connectivity, experience, value, effectiveness through this form of technology for individual disabilities that is possible through, face-to-face physical interaction. I'm really skeptical. Like, and if you look at the things like Statistics Canada and the Canadian Internet Use Survey, you will see there are differences, and by type of disability, people with visual impairments versus hearing impairments versus intellectual, on the use, comfort with the level of use of technology, the pre-COVID level of use of technology, and so on and so on. There's differences with the general population that is, I don't think, is being either recognized, or maybe I would be controversial and say intentionally ignored, because that's a huge problem and a cost to deal with. And if you don't know the problem, or you don't discuss the problem, then you can pretend that it isn't a problem. Yeah.
So I'm curious, Ushnish. When I was speaking with Colleen Christopherson-Cote, who works as a coordinator here amongst lots of nonprofits and social enterprises in the core neighborhoods of Saskatoon, she talked about the need for a reliable income, housing, and food security as being the three primary elements that people need. And I think absolutely she's right. We also talked to Dion Poehler about the universal basic income, which, as you know, has been given a lot of attention during this crisis, although less in the last few weeks, I have to say. But it sounds to me like even all these things, now we might argue that even being able to provide all these things to people universally would require a huge shift in our institutions and our institutional culture, but it might not. And it sounds like even beyond these things, there's something else that people need. And the more vulnerable we are, the more we need them. And that's the human connection you're talking about. And all of those interactions with a wide variety of people that can provide support and companionship and all of those things. So when we talk about things like UBI, Universal Basic Income, as a solution for times like this, is that also, has the conversation been missing paying attention to, again, our most vulnerable people, even though that's who it's designed to support in theory?
Yeah, and the federal government program, the SERB, has been kind of described as at least as a temporary universal basic income. But more recently, by whether it's pressure from the opposition or pressure from the public, there's been a increased focus on surveillance and clawing back some of these payments that were made to people. And again, anecdotally, I've been hearing a lot of people that are being hit by that, compulsory return of money are individuals with disabilities, because they might have had, income from other social programs, this and that. And initially the money was sent out, but now I said, oh, well, if you were a recipient of a social program X or Y, or received money from somewhere else, then you're not eligible and you have to pay that money back. So as it is in like the big cities, like, Toronto, Montreal, Vancouver, and so on, the amount of income in terms of social assistance individual disabilities were getting was not adequate to cover all costs. But so at least with the SERB, there was a little bit of temporary, if you had a little bit of income from a social assistance program, and then some money from SERB, maybe you might make ends meet. But because of now the surveillance aspect of it, that money is being clawed back. And so I think, again, anecdotally, we don't have numbers on this, because again, I would say, I wish the government would produce numbers on, okay, who is the SERB going to? Is it going to people with X amount of income and lower, or is it being really uneven and so on? We don't have any of that data. Is it going to individuals with disabilities or people or not? We don't have any of that data publicly available. So anecdotally, again, I've been hearing that this clawback that's been happening in the past few weeks of the SERB has been hitting individual disabilities really hard. Yeah, but I'm a supporter of universal basic income. As you know, there was the pilot put in place in Ontario by the previous Liberal government, and a lot of the recipients of that, or the participants of that pilot program, were individual disabilities, people on ODSP, the Ontario Disability Program, but the new or the current Conservative government canceled that pilot. So and it was too early. We couldn't tell. Yes, there were some short-term surveys and some data, but we couldn't. I can't tell what the long-term outcomes were, long-term benefits were from that program, and any of the, maybe going back decades, the programs in Manitoba and so on done on they all kind of say that there's long-term results are positive, but there's still an unwillingness, that whole cultural ethos we have, that if you're getting money from the government without working, you're not doing something of value. But if you're working some precarious minimum wage job, that's of value. So that's a cultural kind of issue we have that affects, in many cases, individuals with disabilities who have many other contributions to make other than just working maybe a minimum wage job, which they could do if they were on a universal basic income, but they're unable to. So I don't know. It's a good question whether, given the financial situation the government is in terms of, like, in the last week, they said the deficit or the debt is as high it was after the Second World War, whether how long they will continue this SERB, and if they will think about a more permanent universal basic income. I don't know.
Yeah, Ushnish, and just to add to that, this clawback you're talking about, this is a province by province thing. Based on what I've looked at, some provinces are doing the clawbacks, some aren't. So it really depends on how those disability programs themselves are structured, I do believe. And for those people who are on the student benefits as well, I've not heard of any clawbacks as of yet, but again, you never know. I guess going back to precarity and just how this all kind of works, do you see any opportunities that maybe pop into your mind to say we can think about new ways of building new cooperatives, building new organizations to tackle these specific issues? I'm just curious.
So I mean, there's in the more in some of the circles that I kind of participate, there's the discussion of the new Green Deal, right? And it's not only about kind of environmental sustainability, but also equity. But my only but there is most of the discussion on equity has been on gender and race. I have not heard a lot in the discussion of the new Green Deal on individual disabilities. So I'd like to see more of, maybe coming out of this crisis, there's an opportunity to reformat the economy, make it more sustainable, make it more equitable. And when we say equitable, in terms of gender and race and disability and so on. Where I'm less hopeful is, like, I guess maybe the area of research on my thesis is individuals with intellectual and developmental disabilities. Mm-hmm. And so one of the phenomena I've kind of found in that particular subsector is that in other areas, there's individuals with disabilities leading the organizations for other individuals with disabilities, but for this particular subpopulation, the people leading the organizations are not individuals with intellectual and developmental disabilities. Mm-hmm. It tends to be the clients. Sometimes, in terms of, there's a co-op in Toronto where there's ownership, but ownership is a loose form there. there's a profit distribution. Let's put it that way. So I'm longer term, I'm less hopeful that maybe individual intellectual and developmental disabilities will be able to form their own organizations, because those cultural barriers, and it's just like it's a constructed barrier, right?
Yeah.
So it's that cultural barriers will be in place even if we get a new Green Deal and so on. And so that's a more longer term problem to solve. So in summary, I'd like to see more of that equity discussion in the new Green Deal involve individual disabilities, and longer term, I want to see organizations developed by people with intellectual and developmental disabilities being treated equally, funded and so on as all other organizations.
This is very much related to what Brady just asked, but I'm wondering if you could talk about, as you know, there's a lot of discussion, particularly in the co-op sector, about the resilience of the cooperative model. Does this idea of resilience apply equally, if it's true at all, to organizations serving people with disabilities, cooperatives specifically, or are they once again more vulnerable compared to other kinds of co-ops, would you think?
Yeah, so I think very, very temporarily, there's some level of resilience in terms of, and not because the organizations, the co-ops, or the organizations serving individuals with disabilities, or the co-ops serving people with disabilities have like a large bank accounts or anything like that, but because even if any revenues generated from the market dry up temporarily, they have the government funding that has not been cut off or is still going. My but is, like, what happens in 6 months when all these deficits and debts and things that the government has built up comes home to roost, and whoever the opposition is, or even the public is not willing to pay huge amounts of additional tax or whatever it takes to address the new debt and deficit that we're in place of, then our organizations going to face cutbacks from provincial and federal governments? I would say absolutely. And that's the point I would ask, is the sector resilient? And I wouldn't expect the sector to be any more resilient than the rest of the economy. If there's 25% of the rest of the economy shuts down, the 25% of the sector will shut down. That's my feeling. Yeah.
Where do you see avenues for research in this area now that I'm not sure that we're even anywhere near. Who knows where we are in this pandemic situation or the economic crisis, but when the dust settles, whenever that is, what would be areas of important research, do you think?
Yeah, so I mean, and you point to the areas like the resiliency of co-ops, right? But I'd say there's kind of like so this morning I was participating in this seminar by the International Labour Organization that maybe you guys were participating in too. They were talking about the resiliency of the social economy in general and the co-ops and so on. And I asked the question, okay, so what does the data show? And they're like, we don't have the data. So there's an urgency of now getting that data, saying, okay, so how many co-ops and social enterprises are shutting down or facing a reduction in revenue? Like, the only piece of data I have in Canada is Imagine Canada survey, and that's like a charities only, so that's like a narrow slice, right? And maybe the survey only went out to Imagine Canada members, so that's even a narrow slice of the whole social economy. So we don't have a lot of data, and we need the data now in terms of if we're seeing trends in that need correction, like studying it after the fact doesn't help, or doesn't have the sector. So, the CERB, for example, most of it was distributed through banks and your financial institutions. Did it go through the credit unions? I don't know, right? And did they?
I think the answer to that is that the credit unions had to fight to be able to administer it.
Right.
Because at first it was going through the big banks.
Yeah. So I mean, this is the problem. Like even in kind of the current moment and the urgency of now, we're seeing how the social economy organizations are treated differently. In terms of employment, again, a lot of people from disadvantaged populations, they don't have those full-time jobs in a lot of these organizations that maybe would even qualify them for the CERB. They have like the part-time jobs earning a few $100s per week or whatever it is, that kind of ensures that the other social benefits are not clawed back. So maybe those individuals don't qualify for the CERB because they don't have those full-time jobs at these organizations. So, and we don't have that data. And so I think one of the things I would say in terms of research is we need as much data that we can get, differentiated data, differentiated by type of organization, disaggregated data by gender and race and so on, and disability and so on, that we're not getting. A lot of the disability advocacy organizations have been lobbying for data on COVID cases and tests and deaths by type of disability because we're wondering about like what's going on. But nobody's publishing that data, or maybe not even collect. I doubt they're not collecting it. The healthcare system is not collecting it, but it's just not being published. Like there's a lot of resistance against publishing race-based data in Ontario and Quebec, at least have agreed to publish it. But agreeing to publish it doesn't mean they have published it yet, or even start collecting it yet. So that was a huge lobbying effort to do that. And I would say the voice of the disability communities, even kind of in the midst of this crisis, even fainter or smaller, and that same lobbying effort is going on, saying, tell us, who's dying. Because a lot of these, in Ontario, for example, some of the hotspots were long-term care homes. And when we said long-term care homes, they were facilities which catered to individuals with disabilities, which are not senior citizens, that just needed residential facility. And they were lumped into this whole category of long-term care homes. And there's a news report talking about how one of these facilities where it was taking care of adults with, intellectual and developmental disabilities, and the infection rate was 95%. So we're all wondering, so what does that picture look like in terms of data, the COVID data, and people with disabilities, and we have no comprehensive picture. And if that comes out like 6 months or a year later, and a lot of people will have essentially died out of the process. And so there's like an urgency of now in terms of having that data for research, not just by researchers, but by the community, by other social economy organizations and so on. Yeah.
Related to research, I want to know what you think about, is there a lot of data siloing going on within the broader disability community? As you know, we're kind of not being crowded, but we're being asked to work a lot more together. And I'm wondering if there's a lot of mistrust between our community about, well, what data do we give to other organizations? What data do we personally collect? And how do you think we can maybe overcome that if we want to have a lot stronger research, a lot broader base of research, especially during this crisis?
Yeah, a good question. I mean, there's the intra-politics of the disability community, right? It's not a uniform community. Some sort of sectors of the community would say, hey, there's organizations with a particular type of disability whose voice is louder, the population is greater, and they get more funding. Anyway, so those politics exist in every community, right? Whether it's racial community, disability community, and so on and so on. But in terms of data, it's kind of back to the question of nothing about us without us, right? Yeah. So it's not. It shouldn't be a question of kind of collection of data that is done, all the analysis is done in an ivory tower in a university or something. There has to be a lot of community engagement, and we find that the different communities and just maybe want different kinds of data. Like, so in terms of the COVID crisis, of course, the questions on kind of cases and deaths and so on disaggregated by disability. But in terms of, let's say, the AODA we were talking about, data on how many businesses have complied, how many, I would like to know, how many nonprofits and social enterprise and cooperatives have complied with the legislation. And I wouldn't be surprised if the compliance wasn't any better than all the other businesses, right? Mm-hmm. So that's kind of the data being called on by the community, both short-term and long-term. But yeah, back to kind of nothing about us without us. How do we ensure that the data being collected is the data that's being asked for the community? And the other aspect I want to say is that there's this whole aspect of surveillance. Sometimes like data gets weaponized and gets used against communities, right? And the example I was giving was the CERB. And so if then later on they find out that this is an individual disability receiving some other payment, then the CERB gets clawed back or something like that. So if data is used for surveillance and to disadvantage individuals and communities, that's a negative use of data. So not all use of data is positive. All data is political. There's no such thing as neutral data or it's all facts or anything like that. So we have to be careful in as researchers in what data we're asking for, whether it's relevant to the community, and if it can be used, it can be weaponized and used in a negative terms against the community, then it'd be better off not even collecting the data. Yeah.
There's also the human rights component too. We could be asking for a certain amount of data, but we could easily run up against the human rights commissions and say, well, no, we're not going to give you this data because of X, Y, and Z. That's one of the things that I wonder about when we're trying to collect and get our data is like, well, are we even going to have access to it in the first place?
Yeah, absolutely. And a lot of the data has to be voluntarily provided, right? You can't just be collecting data on people without asking them whether it's okay to have the data. For sure, I agree with you. Yeah.
So I'm going to wrap this up here because I think it's a really good point to end on, and we've also used up almost a whole hour already. But I've been taking notes for the last 5-7 minutes, and I think maybe there are some grants that we could apply for all together. So when this conversation is over, I'll send out an email to both of you, and we'll see if we can get some research underway. It could be really good. I want to thank you, Ushnish Sengupta, for a wonderful conversation. I learned a lot through this, and I also want to thank you, Brady Kroeker, for joining me in asking all the great questions and providing a lot of the great questions for today's conversation. Ushnish, I wish you all the best in the rest of your PhD and all the other work you're doing. It was a pleasure to have you on our conversation series today.
Yeah. Thank you, Jen, and thank you, Brady.